Hi everyone, I'm Dr. Shubhiaggarwal and today we have Dr. Anand with ourselves. He is a consultant in Hindura Hospital. So we're going to be talking about pediatric dermatology today. Sir, I've received many questions regarding a newborn baby. Mothers put old clothes on newborn baby. So is it safe?
So first of all, thank you so much, ma'am, for letting me on your platform. I mean, it has been, a wonderful pleasure. Thank you so much. And regarding, yes, a very important question you have just now asked regarding putting old clothes to a newborn baby. In our family, in our relatives, we have seen, grandparents saying that you should put old clothes to a newborn baby. So point number one, we should not encourage these things. We should not put old clothes newborn baby. The reasoning behind this regarding the allergy, what happens, like our grandparents, they put the old clothes so that they think that baby will not get any allergy to a new, clothes, because some clothes are made up of silk, some are made up of linen. So some babies show some type 1 anaphylaxis reaction to the new clothes. That is why, in a rational sake, they put the old clothes to avoid any kind of allergy to a specific kind of clothes to a newborn. It's better we put a simple linen clothes to a newborn and avoid putting any old clothes which should not be practiced. If it was practicing, it would have been there in the books. So only put linen clothes to the baby. Do not put any old or used clothes to a newborn baby.
Okay, that's nice. Okay, and sir, when should we give bath
Yes,
to a
ma'am.
newborn baby?
Yeah, in our daily practice, we see a lot of newborn babies, a lot of babies getting discharged. Some babies are, the normal weight of a baby is usually more than 2.5 kg. So a lot of
Yes.
parents, they ask us, so when can we give bath to a baby? Should we give bath like just after going home, or if our baby is 1 kg, 1.5 kg, should we give bath to that baby? So for all those having the same question, the answer is you should give bath to you should do sponging, number one. Like there is something known as umbilical cord. If for the viewers, there is something around the umbilicus of the baby, there is a cord, everyone must be knowing about it. And it takes usually 5 to 7 days for that cord to get shrink and the cord to get peel off by itself. So point number one, when the umbilical cord gets peeled off, that is the time you can start sponging in a baby. You don't give
Okay.
sponging to a baby on day of life one or third or fifth. The normal umbilical cord, the normal cord which is there around the umbilicus, it gets peeled off or shed off by around seventh day of life. And from that period onwards, you give sponging to the baby. Do not give bath, like proper bath, of course, is not allowed. Do not use a tub
Yes.
or anything, just a lukewarm water and sponging. That is like more than enough, because if you start sponging a newborn simultaneously, it can lead to something known as hypothermia, something known as the baby temperature, gets down, and it will be difficult for the mother to feed the baby. So seventh day onwards is the best answer, and also sponging, like not giving a proper bath to a baby.
Okay, so till when should we give sponging? And from when can we start a normal bath?
Around
So you're not audible.
onwards, you
Yeah.
started. Is my voice coming now?
Yes. Yes. Yes.
Yeah, there was a call, that's why it got stuck. Yes, so as
Okay.
far as till how long the bath should be done, like seventh day onwards, you will do the sponging until one
Yes.
month of life. Till 1 month of life, when the baby is kind of okay, the baby is kind of trying to, hold his neck or trying to get the new milestones. So by 1 month
Yes.
onwards, we can do little kind of a bath. You can put a bathtub and a lukewarm water and give a little, mild to moderate kind of a bath. Seventh day to 1 month sponging. After 1 month, slowly, slowly give a simple lukewarm water bath to a baby, that is like more than enough. And there are so many, cosmetics or so many advertisements we see on papers and all. So do not use like too much what you called chemicals for the baby. Medicated soap is there. There are a lot of medicated soap which a dermatologist recommends. Anyone skin specialist will recommend. That is more than enough for the baby, ma'am.
Okay. And sir, we have seen that, the mothers, they use massage as like, it is the most important thing in a baby's routine. Like the
Mm-hmm.
baby can't go without massage anywhere. So,
Mm-hmm. Yeah, yeah.
what is your say in this? Because I feel that, it is not as necessary as people think it is.
Yeah, I totally agree with you, ma'am. Actually, the problem is we all are following our grandparents, our ancestors, they used to do,
Yes.
about the sponging or bathing, even a basic thing like giving a sunlight to a baby. Such a common thing everyone keep asking, baby is looking little yellow. Let's give him the early morning sunlight to reduce his jaundice. You must have heard about this also, of course.
Yes.
A lot every third person come and ask me कि इसको सुबह की धूप दिखा दें हम लोग, can we give him a little early morning sun radiations to reduce his jaundice? And that also, kind of, it's like our grandparents, or you can say our ancestors has been telling to our generation, but in books nowhere it has been mentioned. The baby looking yellow to you, get the baby's blood group done, get the mother's baby blood group done, rule out something known as RH incompatibility or ABO incompatibility, and try to get out the cause of the jaundice. But again, giving sunlight or something like that. So our parents, you say that, but again, that is like not mentioned in the books. And coming to the same thing which you are saying, like that's what was your question? Could you repeat the question you were asking?
Yeah, the massages, are they good? Like,
Exactly. So massages, that also. I mean, like, see, again, mild to moderate is fine. Like, you don't have to vigorously massage a baby. Some parent, they hire a nanny which every day massage with proper oil. They say it is very good for the baby's growth and development and this and that. So like mild to moderate degree you can do, but it's don't make it a mandatory habit that you have to massage your baby every day. If massage was so important, then definitely in our standard guidelines, in our our great books, they would have definitely mentioned about it. Take care of the baby, see the milestones. It's very important for the baby. We have to, as a parent, we should see the milestone when the baby is able to
yes.
hold the neck, when the baby is able to smile, when the baby is able to sit with support, without support, and even proper vaccination also. These are some things which are to the point, which are very important. Milestone is important, vaccination is important, growth and development is important. So this is what we should focus more than giving a early morning sunlight to this. My grandmother told, a बच्चे को जन्म घुट्टी दे दो, again, and a very common problem. है ना?
Exactly.
You might have
Yes.
heard about it. Like in our books, there is something known as exclusive breastfeeding. Exclusive
Breastfeeding.
breastfeeding till 6 months of life. Then mother is like,
Hmm.
नहीं नहीं, बाहर तो बहुत गर्मी है, outside is 48 degrees Celsius. इसको थोड़ा पानी पिला देते हैं. Let's give him little water. And then some ma'am patient was calling me. She's like, एक जन्म घुट्टी आता है कि हम एक एडवर्टाइजमेंट देखते हैं, जन्म घुट्टी आता है बच्चे का रिजल्ट. मैंने कहा, प्लीज फॉर गॉड सेक don't give all that. I mean, like if it was that much genuine, I would have personally, we all doctors in every government hospital would have personally prescribed that, janam gutti you say, or water you say, or every thoda शहद चटा दो इसको, the grandmother says that.
Exactly.
So
Yes.
like these are हम सुनते आ रहे हैं, we have been hearing for such a long time, but the book says is exclusive breastfeeding. And the definition of exclusive breastfeeding is like no food or drink unless medically indicated medicine, and breastfeeding started within 1 hour of life till 6 months. That is known as
Yes.
exclusive
Just
breastfeeding.
breastfeeding.
The breastfeeding, the breast milk itself contains around 70 to 80% of water. 80% तो पानी होता है ब्रेस्ट
Hmm.
फीडिंग में. तो अलग से अगर कोई गर्मी है, if it is very hot outside, it's hot summers, बहुत गर्मी है, बच्चा पसीना करे, let's give him water. So no, only and only breastfeeding, no water, no sugar, no jaggery, no janam gutti, no bottle feeding. Only and only, breastfeeding. Even mother says, नहीं इसका पेट नहीं भरता डॉक्टर साहब. His tummy is not full. Have you heard such
Yes,
problems?
I have heard. Yes.
Exactly. So इसका
They
पेट नहीं भरता. हाँ, tell me what you're saying.
they breastfeed the child up to the age up to like the point where the child vomits.
Yeah, exactly, exactly. So that's what, like, नहीं इसका पेट नहीं भरता, नहीं नहीं, let's put him, इसका इसका skin अच्छा नहीं रहेगा, let's put him on formula feed, that let's put him on some Nestle
Yes.
का nan pro, and we have a lot of formula feeds, you know. But again, for the baby's skin, for the baby's body, God has made breastfeed enough. It is the most beautiful and ideal component for a baby. And only if we stress about breastfeeding, you know, a baby's body, baby's skin, baby's everything will be fine. See, as far as pediatricians are concerned, counseling, counseling, and counseling. Before touching the child itself, you should make the diagnosis what is the problem happening with the baby. And because our mothers, our families are so much influenced by the cousins, by the chacha mamas, by the grandmothers, कि नहीं इसको जन्म घुट्टी पिला दो, नहीं नहीं तुम्हारा फीड एनफ नहीं, इसको बॉटल फीडिंग करा दो. No, no, I tried Nestle का nan formula feed, that's very good. Why don't you, no, why don't you not giving cow's milk to this baby? So all these issues, you know,
Yes.
cow's milk, buffalo's milk, we think the baby's skin will be very good. The high protein is there in the cow's milk. बच्चा बहुत अच्छा रहेगा and all that. No, ideal component is breast milk. God has made a very beautiful composition of breast milk, which is the ideal constituent for the baby. As far as doctors, we need to counsel and we need to, you know, a positive reinforcement we have to do to the mother कि मैडम यही आपके बच्चे के बॉडी के लिए, बच्चे के स्किन के लिए और बच्चे के लिए more than enough है.
Yes, sir. And
Yeah.
so, what are the rashes which are normal in a newborn?
Yes, yeah, this is also a very important question which we keep
Yes.
hearing it. Like we have a lot of gynae rounds, labor room rounds. Every third day baby, fifth day baby having rashes on the face, rashes on the back, rashes on the trunk, you know, are there. So, like, I will not go to hi-fi words that we will not be able to understand. But
Yes.
one thing I would like to say is in the beginning 10 days of life, any rash, if you see in a newborn, could be on the trunk, could be on the shoulder, could be on the back. More than 90%, those rashes are physiological. Those rashes are normal. Okay. As a mother, like, of course, we have like huge. Yesterday, I had night duty. Around 34 cesareans were there in the night. There was huge chaos, like a lot of deliveries, and because the government setup, so everyone is like rush all the
Yes.
time. So every third day baby or fourth baby, we see kind of rashes on the face or rashes on the trunk. But most of the rashes, in general, as a layman, if I talk about, out of 10, 8 rashes in the newborn are physiological. They are normal. It is because of the maternal estrogen or mother hormones. It is because of the mother hormones, they get transferred to the baby. So little rashes on the face. There is some entity known as erythema toxicum or some rashes. I will not tell the hi-fi names, but there are some rashes. Out of 10, 8 rashes are normal. They are physiological. Only, you know, like they're self-resolving. You just have to show to a basic your own skin doctor, a pediatrician. But usually out of 10, 8 rashes are normal. You don't have to do anything for that. Even we talk about the umbilical cord also. There's a rashes on the umbilical cord also. Mother gives a history.
Okay.
Okay, there is a little discharge happening from the cord. There is some change in color happening from the cord. मैं इसको मसल
Yes.
दूं? Can I put a tobramycin powder? Can I put an antibiotic powder? But again, for that thing also, it is a self-healing process. Rashes on the face or rashes on the neck, there is some entity known as erythema toxicum, which is a normal condition in a newborn, which looks abnormal, but it is totally normal. So
Normal.
out of 10, 8 rashes are normal. Show to a nearest doctor, like whosoever is your in charge doctor, and only 10 or 20% rashes, you know, they are like important for us. For like there's something known as torch infection, something known as mother having
Yes.
some chicken pox, so she got delivered on that time, so baby got chicken pox. So those few percent of rashes, yes, they are significant, but 80% of them you don't have to treat, you don't have to like do any medication for that actually. That's what.
And so, some more things that you would like to tell us on pediatric dermatology.
So in pediatric dermatology, again, like baby's skin is the most soft thing we can ever feel in life. I mean, every
Yes.
newborn which we deliver, which I touch, I mean, like it's just they're just perfect. Like the skin is so beautiful and so clear. Like number one, avoid any kind of you know, lotions or creams unless your pediatrician or unless your skin specialist. If the baby is having some problem or dry skin, that's a separate entity. But in general, you give a lukewarm bath to the baby, keep the baby very clean, avoid any kind of extra chemical soap. यूज ओनली मेडिकेटेड सोप अलग से आता है मार्केट में, तो मेडिकेटेड सोप आप बच्चे के लिए इस्तेमाल करिए. And later, the baby gets around 3 months old or 4 months old or 5 months old. There are some Johnson products, which I'll write the name later, which have a Johnson lotion or a powder that you can use for the baby. But again, at the see, I tell you, the basic dictum is like if I talk about village, अगर हम गाँव की बात करें, गाँव की औरतों की बात करें, उनके बच्चे जो हैं, they are full of immunity, they are full of power. 2-2 साल के बच्चे भी जो हैं वो माँ का छाती से दूध पीते हैं और खेलने जाते हैं, and again they come back and take feed from her breast, from the mother's breast. They are very strong, they are very immune. अब now, because
Yes.
of this metropolitan cities, because of too much of money here and there, because of this hi-fi hospitals, थोड़ा भी बच्चे में रैश या थोड़ा भी बच्चे को कुछ होता है तो हम जल्दी से दवाइयाँ शुरू कर देते हैं, which is very
Hmm.
very wrong. गांव की औरतों के बच्चे इतने स्ट्रांग होते हैं, कहने की हद नहीं. लेकिन हमारे मेट्रोपॉलिटन की उसमें every third month baby will have pneumonia, fast breathing, because we are oversensitizing with medication,
Yes.
oversensitizing with skin products, with all the chemicals and lotions and creams and emollients we have. So again, मतलब कहते हैं ना 100 बात की एक बात, avoid minimum products. If you really want to use a simple product, Johnson products, baby products are very good. We have a Johnson lotion, we have a cream, everything is there. But again, use to a minimum and a specific quantity. That will be more than enough. That's what,
Yes.
that's what.
So,
So
so that's all.
I hope you got some idea out of it.
Yes, a lot. So I think that's all for today. Thank you so much, sir.
Thank you so much. And this we have a viewer, Satya. He says that could you explain regarding a newborn baby jaundice? He is saying
And
so.
biliary atresia.
Biliary trays, yeah. So in simple words,
Yes.
if I talk about, like, I don't want to use high-five words because we have simple audience also and doctors audience also. So if any baby having jaundice, if any newborn is having jaundice, the commonest causes of a baby being yellow is because of the problem in the baby's and the mother's blood group. There is something known as ABO incompatibility and something known as RH incompatibility. But like, again, in simple words, if a baby has come little yellow, little jaundice to my nursery, then I will check the mother's blood group, whether the mother is negative blood group or the baby's positive blood group. This is known as RH incompatibility. And also I will see whether the mother is O blood group or baby is A or B blood group. This is known as ABO incompatibility. So again, like very simple, if you talk about the babies having, if the baby comes to you with jaundice, number one, how till where the jaundice is there. Jaundice spreads from head to the toe. Is it only at the head and neck? It is at the thorax, abdomen, or full legs. Number one. Number two, you check the baby's blood group and mother's blood group in general. You check. And third, which we do, if we get a what do you call it, blood sample done of serum bilirubin, something known as serum bilirubin, which tells us about the jaundice, and you put the baby on the phototherapy. There is something known as phototherapy, a blue light, a machine is there, which we have in our nursery, and every 6 hourly we have the monitoring of that serum bilirubin levels. And once it come down to the norm, we have a chart in our nursery, term, preterm, according to day of life. अगर बच्चे का उस जोन के नीचे आ जाता है, ग्रीन जोन में, सेफ जोन में अगर सीरम बिलिरुबिन आ जाता है, तो हम बच्चे को फोटोथेरेपी से हटा देते हैं. बट अगेन, दे ऑलवेज से ट्रीट द रूट ऑफ द कॉज, डोंट नॉट ट्रीट जस्ट द कॉज. कोई भी बच्चा
Yes.
जॉन्डिस आएगा, हम फोटोथेरेपी लगा देंगे, लेकिन आप उसे डिस्चार्ज करेंगे आफ्टर 5 days, अगेन he'll come back to you with jaundice. Why? Because you
Hmm.
need to know the cause, because there are some
Cause.
rare causes also. Like my HOD used to say, common things are common, rare things are rare. So rare causes like hemolytic anemias, thalassemias, like hereditary spherocytosis, membranopathies, enzymopathies, G6PD deficiencies. So these are little rare causes जिसमें हमें G6PD enzyme कराना पड़ता है, एक peripheral blood smear कराना पड़ता है to look for
Hmm.
hereditary spherocytosis, pycnocytosis, leptocytosis. मतलब ये सब थोड़े हाई-फाई हैं, हम कहने की बात है. Simple one will be RH incompatibility, ABO incompatibility, mother not feeding the baby well. Naturally, maybe she's a primary gravida. Maybe she doesn't know how to breastfeed. maybe she doesn't have any grandparents at home. She's a single woman. It's very difficult to feed a child. She doesn't know how to breastfeed. So even lack of breastfeeding also can lead to jaundice. So अगर कोई बच्चा jaundice का आता है तो ये छोटी छोटी चीजें आपको देखनी होती हैं, और जो रूट कॉज है उसको आपको अच्छे से रूल आउट करना होता है, ताकि द बेबी इज safe, and being a doctor you are safe, right? Am I, ma'am, what do you think? Am I right or wrong?
Yes, you're absolutely right.
So that's the whole thing. So I think that was enough for today, I guess. Do you think
Yes, sir.
we should, is it enough, or should we discuss something else?
So that's all for today. It
ठीक
was
है.
very great talk. It was great talking to you, and I hope
Thank
to
you.
reconnect with you in future live sessions.
Definitely, every week, every weekend, Saturday or Sunday, we can fix a time, and we both
Yes,
can connect, and have this small issues which are so important in a public domain, and it will be helpful for everyone, I guess.
yes.
Thank you so much, ma'am. That's very sweet of you. And sorry,
Thank you.
I was late. Don't mind.
No problem, sir.
ठीक है. So
Okay.
thank you everyone. Thank you, ma'am. Bye bye.
Bye.